Well, some people are skeptical about the link between health and economic mobility. And I find it interesting, first of all, because the data is very powerful. So I always, when I present this data, I say, well, this is my data, where's yours? Because I haven't seen any data that shows that those two things are unrelated to one another. But beyond that, I think that there is a sort of a common sense intuition that people need to employ when they do this work. And they need to walk in communities and talk to people and ask them, what are their stressors? And they'll tell you. And it's not rocket science. It's there. People are stressed by being, living in a circumstance where they're paycheck to paycheck, or even less than paycheck to paycheck. They are stretching a paycheck, that doesn't cover all of their needs. So one month they're paying the electricity, another month they're paying the car bill, another month they're paying the rent, and then the child's medicine comes up, and that wipes out whatever strategy they had for the next month. But if you have stressors, which we all do, and no resources to cope with those stressors, well, then those stressors just basically fester in you. And in fact, there are studies, a number of studies that show physiologically in our bodies that stress hormones, they rise when you have chronic, constant stress. And those stress hormones actually, they wear down your body. They cause essentially a kind of a premature aging process. They turn down your immune system, and they increase essentially the damage to your blood vessels, to your heart, to your kidneys, and to other necessary organs, because these hormones are designed to be essentially quick response hormones. They're not designed to be constantly elevated in your body. That has adverse effects. So we recognize that stressors are a common explanatory factor for how other domains of your life, your poor job, your poor housing, your crime-ridden neighborhood, your lack of access to healthy food, all of those stressors can actually get inside the body, into the bloodstream, and change your actual physiology and increase the likelihood that you will die prematurely. So it's important for us to use common sense in this work and to recognize that, of course, if you don't have enough resources to take care of your basic needs, you're going to be stressed, and stress is not good for your health. So starting right there using common sense, you don't even need the data to make the link between economic insecurity and instability and poor health.